Good day everyone! I am Professor Jamia Gafud, Level 4 of President Ramon Magsaysay State University. For today's video, endotracheal or tracheal suctioning. First, let's define what is endotracheal or tracheal suctioning. It is a process of applying negative pressure to the distal endotracheal tube or trachea by introducing suction catheter to clear excess or abnormal secretions. Note that there are two methods of suctioning. One is the open airway suctioning or the open method. Two is the closed airway suctioning or commonly known as inline suctioning. What is the purpose of this procedure? First, to maintain patent airway and prevent airways obstruction. Second, to promote respiratory function, optimal exchange of carbon dioxide and oxygen in and out of the lungs. Third, to prevent pneumonia that may result from the accumulated secretions. And then, for nursing assessment, assess the respiratory status, the breathing, rhythm, depth, lung sounds, and the rate. And assess the patient for the presence of congestion on auscultation of the thorax. Note the client's ability or inability to remove secretions through coughing. For the planning, remember that sterile technique is necessary for suctioning. And then, prepare the equipment. Sterile normal-saline suction source, ambu bag connected to 100% oxygen, clean protective goggles, mask or face shield, sterile gloves or open suction, clean gloves for inline and closed suction, sterile catheter with intermittent suction, control port or inline suction catheter. Prior to performing the procedure, introduce yourself and verify the client's identity. So you can ask their names and see their identification tags. And then, explain what you are going to do, why is it necessary, and how he or she can cooperate. Inform the patient that suctioning usually causes intermittent coughing and that this assists in removing the secretions. Perform hand hygiene to reduce transmission of microorganisms. Next, set up the equipment and prepare the client in semi-fowler's position if not contraindicated. Wear your personal protective equipment, goggles, gloves, mask or face shield, potential for contaminations. Turn on the suction apparatus and set in accordance with the agency protocols. Note that significant hypoxia and damage to tracheal mucosa can result from excessive negative pressure. Secure one end of connecting tube to suction machine and place other end in a convenient location within reach. Use inline suction catheter or open sterile package on a clean surface using the inside of the wrapping as a sterile field. Next, prepare the catheter and prevent transmission of microorganisms. Catheter size not exceeding 1/2 the inner diameter of the airway. Catheter exceeding 1/2 the diameter increases possibility of suction-induced hypoxia and atelectasis. Prepare catheter flush solution. With inline catheter, use sterile saline bullets to flush catheter. With regular suctioning, set up a sterile solution container and being careful not to touch the inside of the container filled with sterile saline or water to flush catheter. With inline suction catheter, use clean gloves. With regular suctioning, use sterile gloves. Maintain sterility. In regular suctioning, the dominant hand must remain sterile throughout the procedure. Ensure equipment function. Check equipment for the proper functioning by suctioning a small amount of sterile saline from the container. Remove or open oxygen or humidity device to the patient with non-dominant hand. Opens artificial airway for catheter entrance. Have a second person to assist when indicated to avoid unintentional extubation. Replace oxygen delivery device or reconnect patient to the ventilator. Hyperoxygenate and hyperventilate via 3 breaths by giving patient additional manual breaths on the ventilator before suctioning. Hyperoxygenation with 100% oxygen is used to offset hypoxemia during interrupted oxygenation and ventilations. Without applying suction, gently but quickly insert catheter with the dominant hand during inspiration until resistance is met, then pull back 1 to 2 cm. Catheter is now in tracheobronchial tree. Application of suction pressure upon insertion increases hypoxia and results in damage to tracheal mucosa. Apply intermittent suction control vent of the catheter. Rotate the catheter between the dominant thumb and forefingers as you slowly withdraw the catheter. With inline suction, apply continuous suction by depressing suction valve and pull catheter straight back. Time should not exceed 10 to 15 seconds. Intermittent suction and catheter rotation prevent tracheal mucosa when using regular suction method. Replace oxygen delivery device. Hyperoxygenate between passes of catheter and following suctioning procedure. Replenish oxygen. Recovery to base partial pressure oxygen takes 1 to 5 minutes. Reduces incidence of hypoxemia and atelectasis. Rinse catheter and connecting tubing with normal saline until clear. This process removes the secretion from the catheter. Monitor patient's cardiopulmonary status during and between suction passes. Observe for signs of hypoxemia such as dysrhythmias, cyanosis, anxieties, bronchospasm, and changes in mental status. Once the lower airway has been adequately cleared of secretions, perform nasal and oropharyngeal or upper airway suctioning. This removes the upper airway secretions. The catheter is contaminated after nasal and oropharyngeal suctioning and should not be reinserted into the endotracheal or tracheostomy. Position of upper airway suctioning. Wrap the catheter around the dominant hand. Pull off the glove inside out. Then catheter will remain inside the glove and pull off the other glove in the same fashion and then discard. This process will reduce transmission of microorganisms. Then, turn off the device.
Woo!
Position the patient that promotes comfort. Communicate caring attitude. And then, support ventilatory effort. After that, reassess patient's respiratory status. Indicates patient's response in suctioning process. Last but importantly, document the procedure done, including the amount and description of the return upon suctioning and any other relevant assessment. Let's end our video. Thank you for watching.